Do you hear noises that aren't really there? You might be dealing with tinnitus. Tinnitus is a peculiar phenomenon, where you perceive sounds that don't have an external source. It can manifest as ringing, buzzing, hissing, or clicking that only you can hear. It's not a disease itself, but a symptom, often linked to hearing loss or other underlying conditions. It can be a minor nuisance for some, but for others, it's a persistent disruption, affecting their daily life. Dealing with tinnitus can be challenging, but there are several strategies and treatments that can help manage the symptoms. One of the primary strategies for managing tinnitus is sound therapy. This approach involves the use of background noise to help mask the ringing or buzzing sounds associated with tinnitus. These background noises can take various forms such as white noise, soft music, or ambient sounds like the rustling of leaves or the gentle hum of a fan. The goal is to provide a soothing audio landscape that can help distract your brain from the constant noise of tinnitus. To deliver this sound therapy, a range of devices can be utilized. These include white noise machines that produce a static sound which blends into the background, or hearing aids that can be programmed to generate soft sounds. Additionally, there are several smartphone apps available that can play a variety of soothing ambient sounds. By providing a constant but unobtrusive audio backdrop, sound therapy can help to lessen the impact of tinnitus, allowing you to focus on the sounds you want to hear. Sound therapy can provide relief and make tinnitus less disruptive in your daily life. Cognitive behavioral therapy, or CBT, and tinnitus retraining therapy, or TRT, are two effective therapeutic strategies for managing tinnitus. Let's first dissect cognitive behavioral therapy. In the context of tinnitus, CBT isn't about changing the physical noise. Instead, it's about changing your response to the noise, your thoughts and feelings about it. It's about helping you to shift your focus away from the tinnitus, so it becomes less intrusive in your life. This therapy involves working with a trained professional who will guide you through various strategies to change the way you think about and respond to tinnitus. These might include challenging unhelpful thoughts, learning relaxation techniques, or practicing mindfulness. The aim is to reduce distress and improve your quality of life. Now let's move on to tinnitus retraining therapy. TRT is a process that combines sound therapy with counseling and education. Its aim is to retrain the brain to perceive the tinnitus sound in a less distressing way. It's like learning to ignore a ticking clock or a humming refrigerator. Over time, you learn to tune out the tinnitus, so it becomes part of the background noise, not a distressing or intrusive sound. TRT is a two-pronged approach. First, sound therapy is used to reduce the contrast between the tinnitus and silence. This could be through a white noise machine, soft music, or ambient sounds. Secondly, counseling helps you understand tinnitus better and learn strategies to cope with it. Both CBT and TRT are not quick fixes. They require time, patience, and commitment, but the results can be life-changing. They can help you regain control, reduce the emotional impact of tinnitus, and ultimately, improve your quality of life. It's important to remember that every individual's experience with tinnitus is different. Therefore, the effectiveness of these therapies can vary from person to person. Always consult with healthcare professionals to find the most suitable approach for your specific situation. With the help of CBT and TRT, one can reduce distress and improve quality of life. Stress often exacerbates tinnitus. However, mindfulness and relaxation techniques can help manage it. Mindfulness is about staying present, focused, and accepting of the current moment without judgment. It's a powerful tool that can help us navigate the challenges of tinnitus. One way to cultivate mindfulness is through meditation. By sitting quietly and focusing on your breath, you can learn to observe your thoughts and feelings without getting caught up in them. This can help you manage the stress and anxiety that often accompany tinnitus. Deep breathing is another technique that can help. It's simple, yet incredibly effective. When you breathe deeply, it sends a message to your brain to calm down and relax. This can help reduce the perceived intensity of tinnitus and make it more manageable. Yoga is not just about flexibility and strength. It's also a practice of mindfulness that incorporates deep breathing and meditation. Regular yoga practice can help you stay grounded, reduce stress, and improve your overall well-being, which can in turn help manage tinnitus. Progressive muscle relaxation is a technique where you tense and then relax different muscle groups in your body. This can help you become more aware of physical sensations and achieve a state of deep relaxation. It's another wonderful tool in your tinnitus management toolbox. In addition to these relaxation techniques, maintaining a healthy lifestyle is crucial. Regular exercise can boost your mood, reduce stress, and help you sleep better. All these factors can potentially reduce the symptoms of tinnitus. A balanced diet is also important. Some people find that certain foods or drinks like caffeine or alcohol can exacerbate their tinnitus. It's worth exploring if dietary changes can make a difference for you. Adequate sleep is another key factor in managing tinnitus. Tinnitus can make it hard to fall asleep, but lack of sleep can also make tinnitus worse. It's a vicious cycle that can be broken by good sleep hygiene and relaxation techniques. Remember, everyone is unique. What works for one person might not work for another. It's all about finding what works best for you and sticking to it. Maintaining a healthy lifestyle and practicing relaxation techniques can significantly improve your ability to cope with tinnitus. When dealing with tinnitus, professional support is crucial. Like navigating a labyrinth, finding your way through the complexities of tinnitus can be overwhelming. This is where the expertise of audiologists or ENT specialists comes into play. They can offer personalized advice and treatment options tailored to your unique needs, helping you to manage the symptoms more effectively. Now imagine having a compass in this labyrinth. That's what education about tinnitus can provide. By understanding the nature of this condition, its triggers, and the various strategies to manage it, you're better equipped to navigate your journey. Knowledge, as they say, is power. But it's not just about accumulating knowledge. It's about shared experiences, mutual understanding, and collective wisdom. That's where support groups come in. Connecting with others who are also dealing with tinnitus can offer a sense of community and understanding that's hard to find elsewhere. These groups can provide valuable coping strategies, emotional support, and a platform to share your own experiences and insights. I know it's tempting to try everything at once, hoping to find a quick fix. But remember, tinnitus varies greatly in individuals, so what works for one person may not work for another. Just as each person is unique, so too is each person's experience with tinnitus. Therefore, it's important to consult with healthcare professionals to find the most effective approach for your specific situation.